2006 to pursue my dreams to become a neurosurgeon. I don't look like your average neurosurgeon, do I? I look a little bit too funky. Yes, when I was in medical school, I organized the biggest carnival in medical school. So when I told my classmates that I was going to be a neurosurgeon, what do you think their response was? They laughed, isn't it? Okay. Anyway, that's just about the next slide. So we are going to talk about reversing medical tourism. Sometimes I wonder what reversing means. Does that mean does reversing medical tourism, does that mean you want to actually reverse things and actually have found medical tourism? Is that possible? It's possible, isn't it? Okay, but I think reversing medical tourism means actually trying to stop medical tourism if you can, isn't it? Next slide. Okay, so when you look at the healthcare system in Nigeria, and I think the Commissioner of Health here in Kaduna State the Honorable Commissioner has talked a little bit about it, we have lots of issues, isn't it? Now, previously, we thought that as an African country in sub-Saharan Africa, most of our issues will be infectious diseases, isn't it? Tuberculosis or whatever. Now, we now have this other stuff, non-communicable diseases, hypertension, diabetes, cancer. So, do you think people go outside Nigeria because of malaria, typhoid, tuberculosis, HIV? Is that why they go outside Nigeria? Does this look familiar? It does look familiar, isn't it? I can see brain and spine surgery there. Did you guys know that neurosurgery is actually brain and spine surgery? Yeah, but orthopedic surgeons also do spinal surgery as well. But those that were even delivering babies. Even delivering babies. Thank you very much. Even delivering babies. Okay, next slide, please. Okay, one of the things I like doing anytime I give a talk regarding reversing medical tourism, I'm a neurosurgeon, so I talk about what do we not have in Nigeria as of today, 2021, in terms of providing neurosurgical care. Because one of the statements that I make it very, very boldly that I always say is that 85% of people who actually go outside Nigeria for neurosurgical care actually do not need to go outside. Honorable Commissioner, your mom, you went to Lagos, isn't it? You're okay. They don't need to go out. And so, fantastic job by CHELP. Where's Dr. Buola? Yeah, fantastic job you guys are doing, because that advocacy to actually let people know about the availability. Remember, we talk about 3 A's, isn't it, for healthcare? Availability, accessibility, and affordability. In terms of availability of care, the private health sector players have done an absolutely fantastic job in terms of availability. But, Honorable Commissioner, you know that we are still struggling when it comes to affordability and accessibility. A big struggle, isn't it? But at least, like you said, it's not all doom and gloom. At least we are winning a little bit with availability. But what don't we have in neurosurgery specifically? I mean, neurosurgery, so I'll talk about neurosurgery. So basically, that thing there, when you talk about what we call movement disorders, things like Parkinson's disease, things like dystonias and stuff, there's what you call, when you insert deep brain stimulators. Generally, functional neurosurgery, epilepsy surgery, okay? I spent about 1 year in Liverpool. And I was in the functional neurosurgery unit there. And I was like, man, why am I wasting my time here? I'm going back to Nigeria. We're not going to do any functional stuff in Nigeria. But functional neurosurgery, epilepsy surgery is a struggle. We don't have that in Nigeria. Just forget about it. But in reality, how many patients will you actually see that actually even need those kind of services? So in terms of service planning, yeah. The other thing is neuroradiology intervention. So patients who have arteriovenous malformations, they have a brain aneurysms, is a struggle. It might be coming up soon. Hamid, I thought Hamid was supposed to be here. Yeah, it is coming up. Yeah, but presently it's not widely available. It's not available. Okay. And then the other one is gamma knife. Gamma knife, where you actually, it's radiation, but you actually focus a high dose of radiation to a particular point. I was in a meeting, a high-powered meeting 2 days ago, and there are discussions about getting a gamma knife, stereotactic radio surgery to Nigeria. Okay? In the whole of Africa, Egypt, Algeria, South Africa, they have this. But in sub-Saharan Africa, West Africa, Central Africa, Eastern Africa, nothing. But there are discussions about getting this to Nigeria. Okay? Which would be great, isn't it? Good. So this is what we don't have in neurosurgery, and I stated very clearly, more than 85-90% of people who go outside Nigeria for neurosurgical care actually do not need to go. I'm stating that very clearly. Who is Next slide. Okay, so one of the things I like doing is showing some pictures, videos to actually tell us what the realities are. These are real in Nigeria. Because of the way healthcare has been in Nigeria, poor healthcare system, all the things that you and Dr. Ola have already alluded to, the trust and the faith and the confidence in the system is down, isn't it? So usually when I put you're like, are you sure this is Nigeria? Are you sure? Okay, story. 36-year-old lady. I think this was August 2017 or so, August 2017. And then all of a sudden, she has some headaches, and about 1 week down the line, she develops what we call ptosis. Can you see her eye? And of course, what do you think they were treating her for? What were they treating her for? You're even going too far. What were they treating her for? Malaria, cough, malaria and typhoid. Malaria and typhoid. Okay, but at least at some point, she got to some people who are doing a little bit of basic thinking, and then they did a scan for her. Next slide, please. It's actually a video. Seth, can you play the video, please? And actually did a scan for her, a CT scan, and then this is like actually teasing out the image from the CT scan. And you can see that sort of balloon part of the blood vessel there. She had a large aneurysm on that side, and the aneurysm is a weak spot on the blood vessel. Okay, the two key predisposing factors are smoking and high blood pressure. So she had a big spot, and that big balloon spot there is actually pressing on the third nerve on her eye. It's the nerve that helps her to actually look that way, if it's that eye, and also helps her to open the eyelid as well. So if it's pressing on that nerve, that's why she has what we call the ptosis, having difficulty opening the eye, isn't it? Okay, so she was based in Lagos, and they actually flew over to Abuja for myself and my team to actually look after her. Next slide, please. And it's also a video as well. And so, of course, there are two key ways of treating this kind of patients. The first way, which most patients, the neurosurgery interventionist or neurosurgeons that do vascular work will actually have first refusal in treating such patients. And it's actually a minimally invasive procedure where they go through blood vessel in the groin, go all the way around the heart up to the brain, and deploy platinum coils. Do we have that in Nigeria now? Were they available? No. So the second way to actually treat is actually do a proper brain operation. I'm going to go back because I'm going to show them what to do actually a proper brain operation. So these guys actually come all the way to Abuja, myself and my team, and we treated her. She had an operation. She had a complex brain operation. Usually, most of the teaching hospitals in Nigeria, most of the hospitals, you have neurosurgery happening, but it's more like trauma. But when you talk about complex brain operations, it's a struggle, isn't it? Yeah. But this actually happened in Nigeria. So that's us putting a clip around the. Can you see the aneurysm? The aneurysm is that sort of ball around there. We are putting a clip across the neck because the problem with an aneurysm is that if it is rupture, 30% of patients don't even make it to hospital. So we put the first one. We're not happy. It's probably clipping some of the branches there, and then we take out that one. Now we are happy with it. Okay, and then we say, oh, let's punch that so you actually release some of the blood out, and it goes down and release the pressure off the nerve, and then we punch it, and then we coagulate a little bit to shrink it. Guess what? That's actually happening in Nigeria, in Abuja. Real life. Next slide, please. And that's her. A few months later. You can clap now if you want. Okay, next slide. Okay, so that's a gentleman in his early 30s. He has that thing in the center of his head. Okay, that's an MRI brain. The white side, who knows what the medical students here? What's the white in the picture? Medical students, residents, doctors. What's the white? What? Honorable Commissioner. Well, okay, but Honorable Commissioner is absolutely right. Those are ventricles, isn't it? But we actually have something in the center of the head there, actually blocking the outflow of those ventricles. It's called the colloid cyst. Now, what's the problem with someone who has a colloid cyst? What's the problem? Sudden death, isn't it? Sudden death, yeah, hydrocephalus, but sudden death. And it's unexplainable. Why did that happen? Maybe because there's like a ball and valve effect or something like that. I don't know, but sudden death. This chap was in Lagos as well. And then he ran into trouble one day and he had lots of headaches, was feeling really unwell. And then one of the chaps there was talking about putting shunts on two sides, two shunts. I'm like, okay, that's an overkill. Why don't we just take out the cyst that's causing the problem? And so, again, he came to me in Abuja. Next slide, please. And of course, that's him on the Mayfield head pin. The drawing on the head is just to give an idea of where we want to, what we want to do or where we want to go to. Next slide. Okay, that's me and my Marvel comic hat and my colleague Dr. Ogumbo. We are starting the operation there. Next slide. Okay, now I'm sure people wonder, what am I looking at? Okay, what are we looking at? In this operation, go back a little bit. Just go back a little bit. Let me show you something. Go back. Go back. Okay, look at this. There's what they call the hemispheres, the two halves of the brain. So inter-hemispheric fissure means in between the two halves of the brain, isn't it? Okay, look at where the tumor is. We're going to come down in between the two halves of the brain. The black area just above the white is called the corpus callosum. Is the part of the band of tissue that connects the two halves of the brain. Okay, so we actually want to go through that, actually get to where the tumor or the cyst is. So we can go back to where we were before. Set. You're doing a fantastic job, meanwhile. Okay, so we're actually in between the two halves of the brain there. And the white stuff just at the end of where the bipolar is actually the corpus callosum. So we're actually trying to go through the corpus callosum. Next slide. We're actually now through the corpus callosum. And the bit just at the top there, the grayish bit, that is the tumor. Okay, next slide. So you know that thing, I'm sure you guys sometimes you hear, the operation was successful, but the patient is dead. But the operation was successful. Does that sound familiar? No, these patients are very well, they are alive and well. That is the success of an operation. Next slide. This one is just a straightforward video. I'm not going to talk much, just watch the video. Next slide. Next slide, please. Set. Okay, so key question is, can complex brain and spine surgery be done in Nigeria? What do you think? Yes, it can. Okay. The Nigerian patients are worth it, isn't it? So you can spread the news. Complex brain and spine surgery can be done in Nigeria. So we are talking about reversing medical tourism, or even pushing to the point where there's actually not have inbound medical tourism. Okay? But the question is, and I'm sure the Honorable Commissioner has talked a lot about this. What is the cost to us as a people, to the country? A publication in the Guardian newspaper on the 8th of October 2020. These are some of the things that I actually saw there. 1.3, at least about 1 billion yearly. What was the budget this year for health nationally? About 547 billion, isn't it? What's the present dollar rate? So that means we are spending almost our national budget every year on treatment outside. And PricewaterhouseCoopers has estimated that this could actually pay for about 3.7 million treatments within Nigeria. That's what it's costing us. Next slide, please. So what are the issues? Again, Honorable Commissioner has spoken about them. Margaret has spoken about them. Human capital, human resource for health. Honorable Commissioner, I'm going to say a big thank you because you said this initially. And I cannot stress this enough. Governments, private players, they think that when you put in equipment and buildings that automatically they're going to provide good health care for people. That's a lie from the pit of hell. The human beings are the most important. They are all important. Everything is important. But the human beings are extremely important. The capacity in terms of human resource for health is extremely weak in Nigeria. Remember, I'm trained in the UK, and I've been back in Nigeria for about 4.5 years. If I tell you that the capacity in Nigeria is weak, oh, please, believe me, extremely weak. If we are going to do anything at any level in healthcare in Nigeria, we must be proactive and really serious about the human resource for health. It is not a joke. Very weak. At this rate, you're going to keep changing it. Infrastructure, I don't need to talk much about that. Infrastructure, technology, buildings, isn't it? And remember, another key thing that we always forget is that healthcare does not stand on its own. It's interconnected with everything. Sanitation, environment, power, roads, your primary, secondary delays and stuff like that. Funding and financing. I know the Commission has talked a lot about that. Yeah? Sometimes I hear people say things like, oh, you know, we are the 60th exporter of crude oil. We're a rich country. We are not a rich country. Please, let's not deceive ourselves. We are not a rich country. You know, so we are towards more of a low-income country when you look at GDP per capita, per person. And of course, organized systems. I'm not going to spend time here. Issues, we all know what the issues are. We all know what our problems are. The problems, they are numerous. Next slide. Okay, then, so what's the way forward then? Thank you again, Honorable Commissioner. I really love the presentation. Way forward. Honorable Commissioner has talked a lot of things. Maybe I'll add a little bit of salt and Maggi there. Next slide. I was interviewed about 2 weeks ago, and one of the people was a Zoom interview, and then somebody was talking to me about doing like private insurance, or maybe a few people coming together, pulling a few people together and stuff, and I said, oh, that's fantastic. But if you truly want to provide care on a large scale for Nigerians, 212 million people, you cannot run away from this. Governments at all levels must be involved. Must be involved. Extremely important. That's why I say that everything rises and falls on leadership. But of course, followership is extremely important as well. We're going to be changing governments in less than 2 years. Is it up to 2 years? In less than 2 years, isn't it? C-Help, again, fantastic job you're doing. The advocacy for healthcare is extremely important, and pushing that into the consciousness of our leaders at all levels. Extremely important. The days of healthcare being an afterthought, or the days of a government aspirant or any aspirant coming and say, oh, I will give you free maternal and child healthcare. Where is the money to provide it? Where is the strategy to actually provide it? What capacity do you, as someone say you're coming as a governor and your team, what are you going to tell us about how you're going to really provide healthcare? The tripod of any developed economy is health, education, and infrastructure. It is extremely important. In the UK, anytime they're actually doing manifesto, they're trying to change governments, what do you talk about? The National Health Service, isn't it? In the US, Obama, remember Obamacare was a major issue. Healthcare is serious stuff. It's not an afterthought. Next slide. So, way forward, human capital, human resource for health. See, if we do not tackle this, and of course with the issue of brain drain, if we do not seriously tackle this, we are wasting our time. We need to take this extremely seriously. Really, really seriously. Can you see I'm really hammering on this part? Really seriously. Just imagine me trained in the UK coming back to Nigeria. Imagine what I go through every day. It's extremely difficult. Sometimes some of my colleagues in the UK, they say, oh, we would like to come and join you. I'll tell them, I say, hey, this is not for everybody. You have to be crazy like me. And I am crazy. You have to be crazy like me. The places I provide, more than 80% of people don't like me. Why? Because I come in with a new work ethic. I don't take nonsense at all. Anybody misbehaving with a patient, I ask them if this was your mother. Somebody told me when they're a young doctor, I came in and I told a doctor, say, hey, make sure this happens for this patient. And then somebody else now said, oh, you're so passionate about your patients. And my next question to the person was, so if this was your father, what would you want? Human resource for health, very weak, ladies and gentlemen. Sorry. We have to do something about that, and we have to be strategic about it. We have to look at, hey, how can we do this? What strategies can we actually use to actually build our capacity when it comes to human resource for health? Infrastructure, extremely important, but we must be guided. The thinking that man wants to just throw something solves the problem. We have to start moving away from that. It's not just about money. You look at your own natural endowments or what you have and find innovative ways to work within that. Extremely important. You have a very massive population. How do you actually galvanize that population and use them appropriately? Human resources, when you think about our educational system, sometimes I keep saying that, oh, how many federal universities do you have in Nigeria? More than 40, right? And all of them offer microbiology and zoology and botany. Please, well, how does that contribute to national development? Seriously. So there's a question about even our educational system. How is it, what's the strategy? If you read botany, microbiology and zoology in Nigeria, then you come out, what are you actually offering to the president in Nigeria? Think about it. Funding and financing. We talked about our budget just now. But same thing as well, even though you have that small money, how are you committing those resources? What are you using them for? Organized systems. Our systems are also very weak as well. And let me tell you one thing that's really painful for me. Yeah, public sector, nobody cares, isn't it? If you go to a public hospital, you're treated wrong, or who cares? So everyone's going to get paid. But the most painful part for me, ladies and gentlemen, is our private sector. I work in the private sector. You would think that in the private sector, because they have the yam, the knife, they have the bat, the ball, they have the court, everything, you would think that they will create cultures and systems where safety, quality will thrive, isn't it? But no, the first thing the average private player thinks about is money. Oh, what's my profit going to be like? And generally, most of the private organizations that I interface with, they don't like me. Why? Because I always put quality and safety first. And usually that quality and safety will mean that you will lose some money. I'm seeing a patient in your hospital, your hospital does not have the kind of theater that will operate the patient. I say, no, sorry, I cannot operate the patient in your theater. And they'll be like, we don't like this guy. It doesn't matter, don't like me. But when your own mother or your father needs the operation, I'm sure you will want it in your hospital. Two of us. Let's stop deceiving ourselves. Organized systems, okay? And that's what the organized system, that's one place where governments need to come in. Like I said, it's not all about money. Regulation that, you understand, that has, you understand, how do I put it? Regulation that just makes some basic common sense, throw in a little bit of technology. I'm sure every day you have people from Sweden, Indians coming into Nigeria, isn't it? And they're assessing patients and stuff. Just imagine the amount of money the Medical and Dental Council will be making if truly, you can actually register those people for 1 month, 3 months, whatever. Regulation. Just build organizations that work. Next slide, please. Set. We love those words, don't we? We keep reading them, what? Translating them to reality. One of the first things I noticed when I came back to Nigeria was that everybody likes to be the organ of something. You understand? But I'm the MD. I'm the medical director. This is my hospital. My hospital might be useless, so it's not really providing me the package, but I'm the MD. Yeah, exactly. See you. Major problem. Everybody keeps asking me every day, when are you going to build your own hospital? When are you going to build your own hospital? And I say, well, building my hospital is good, but I'm more passionate about actually creating and pushing quality. Well, of course, in a system, low-income country, lots of poverty around and stuff, there's that issue of people actually struggling, you understand, and struggling for their own. We run a very fragmented system, very fragmented. Huh? The Honorable Commissioner talked about things vertical. You're running different programs. The two programs are doing the same thing, but you're running, this one is running, or I need to show them that I'm doing my own program, and so my name can be there. In a low-income country, where you're struggling with funds, we also need to learn to support each other. Extremely important. See help, big up once more. You know, it's a little bit painful that you don't have more people here to actually hear these kind of discussions. Healthcare is extremely serious. It's extremely serious business, ladies and gentlemen. Next slide. Okay, I just put this in there because, yeah, like I keep saying, the building of the human capacity in terms of the human resource for health is so really important. And there's a tendency for us to focus on this part of the world more on the technical skills. You know, I'm in a few WhatsApp groups. For example, the Nigerian Spine Society, all of us who do spine care in Nigeria, and most of them, they say, look at my power, I'm a very great surgeon. We did surgery, look at my surgeries. But nobody ever talks about, so you've done this in surgery, how is the patient? How is the patient? So there's a tendency for us to focus more on technical skills. Why do you think the average person who has at least a little bit of money will want to go outside Nigeria? Why? Do you think it's just about the fact that, you were given the right drug or you had the right operation? No. It's about the journey, isn't it? The patient journey is extremely important. I bet you the average person in Nigeria would rather go to a Babalawo or go to a chemist or a patent medicine store because they're treated better than in the hospital. Do you know what the experience is like going to a hospital in Nigeria, especially public hospital? You will run here, they say, go and buy drugs here. You will run the other side. When you get there, they say, okay, wait now, stay aside. Terrible, isn't it? But also, every time I'm interviewed on radio or TV, they're always asking me, why do Nigerian doctors and nurses not behave well? And I'm asking them, are Nigerian doctors and nurses not Nigerians in Nigeria? Why are you expecting them to behave differently? Although it's painful, isn't it? Because in other sectors, they deal with different things and stuff, but in the healthcare sector, we deal directly with life, isn't it? Life and limb. So it is painful. Again, back to what I said before, that this issue of building capacity for human resource for health is extremely important. Okay? Soft skills is a major issue. Major issue. Yesterday, I was in one of the hospitals that I do a few clinics in. And then I walked to the customer service place. I had been speaking to a lady there before about issues of actually putting the patient on the electronic medical record system. Okay? I went there. I can't pick faces and all. So I got there and said, hello, hi. The patient that you put on the system, I was like, I don't know what you're talking about. I just keep walk. And she continued. Now, what if she had said something like this? Hello, sir. Sorry, I think you're mistaking me for somebody else. But, sir, what's the problem? I'm sure I'll be able to sort that out. Is there a difference in those two ways of talking? There's a difference, isn't it? Soft skills. Soft skills. It's a big issue. A big mountainous issue. It's a big issue across board. Across board. But when you're vulnerable, you're ill, and you go into that hospital, that healthcare facility, and you generally talk to the way the average Nigerian person that is providing customer service, they talk to you. Whoa. Not a joke. Not funny. So, leadership and management, organization of service, patient safety and quality improvement, communication and empathy, communication. When I got to the UK, to the United Kingdom the first time, when I started my training, everything was about communication skills. Communication skills. I was like, hey guys, you want to kill me? Which one is communication skills? Communication skills. And then I came back to Nigeria. I was like, oh, now I can see the reason why. Communication skills. Communication skills. Usually when patients come to see me, and usually they're like, oh, the fee that we pay for consultation is so much. And then when they finish consulting, you're like, oh, no wonder it's so much. because they actually feel that they actually got some quality in terms of how they were assessed and how I actually interfaced with them. Multidisciplinary teamwork. In most of the public hospitals, you're still having the nurses and the doctors fighting, and the medical lab scientists, everyone's fighting. I wish that all of them actually pull together and actually advocate together for the Nigerian patients, which includes they themselves, because they are all potential patients as well. And of course, things like situational awareness, emotional intelligence, social intelligence, these are things that should be taught in physiotherapy school, as undergrads, in nursing school, in medical lab science schools, in medical schools. These things should be taught. And not just taught as theory, but they should be made to actually act this out, to translate the theory of non-technical skills or soft skills into reality and actually live them. It's extremely important. You want to reverse medical tourism, isn't it? You want Nigerians to be comfortable coming to your facilities in Nigeria and getting good care. You cannot do it without this. Sorry, you cannot. Or you want to actually have inbound medical tourism, and the people come and you're like, madam, go sit down here, I beg. I get busy, I beg. Sorry, it cannot happen. We need training, human resource. Can you see? I keep hampering it. It's extremely important. The human beings make the difference. So you have to make significant input into those human beings. We cannot shy away from it, ladies and gentlemen. Next slide. Okay, so what are some innovative strategies? Meanwhile, Honorable Commissioner, the strategy of the WHO global thingy and so on, that I really didn't know about that. That's, if we could actually do that, that would be fantastic. Really good. But also, Honorable Commissioner, yes, we have a moral duty, isn't it? You cannot just, it's not good for you to just graduate yourself from medical school and help. Yes, but hey, we are human beings, man. I keep telling people that, man, we cannot solve problems. We have big problems and big challenges out of the goodness of people's hearts. In where I come from in the South, we will call it church mind. You cannot say, well, guys, use your church mind now. Use your church mind. There are many Muslims that will use your mosque mind now. Use your mosque mind. Yeah? Sorry, it doesn't work like that. You have to build systems. Yes, that's why I started by saying that you need leadership that is courageous. When you have problems where we have, courage must come in. You can see, our problems are big. It's not for the faint-hearted. Public-private partnerships. Well, I run things in a place called Garki Hospital in Abuja. To me, I think it's one of the excellent examples of public-private partnerships and how it can really work. Public-private partnership is the way to go, okay? Because if you want to continue things the way they are, especially in our public hospitals, if I give you statistics, they're just mind-blowing. You just wonder, you just ask yourself, what is wrong with us as a people? What is really wrong with us? What issues, though? Let me just give you just a little statistic. I was trained mainly in Sheffield and Leeds. Okay. Now, in the Neurosurgery center in Sheffield covers a population of 2 million people. 2 million people. That's what it covers. Okay. Every blessed day, there are 2 theaters running. 2 theaters running, and that's apart from the emergency theater. So that means if an emergency comes into the door, it goes to that theater. But there are 2 theaters running standardly. So how many theater sessions do you think are happening in a week? Like 10, I mean. How many in a month? Like 40. How many in a year? At least almost 500. Let's look at National Hospital in Nigeria, in Abuja. National Hospital. And in that hospital I talked about in Sheffield, right? There are roughly about 13 consultants, 13 to 15 consultants. UK has 31 neurosurgical units. National Hospital. In Kogi State, I think they just got 1 neurosurgeon. Niger State, probably they'll struggle to have a neurosurgeon. Nasarawa, I don't think they have a neurosurgeon. So all those places will come to Abuja, isn't it? Now, National Hospital has only 2 neurosurgeons. And they have 1 theater session every week. It doesn't sound like a joke. Do you know the population, the sheer population that National Hospital covers in terms of neurosurgery? just gives you an idea for, it's just like we are joking. We are not serious at all. And so that's why you need leadership that is committed. You also need leadership that is committed, that can put pressure, what I call positive pressure, on leadership as well. So public-private partnerships is the way to go. You cannot leave the public hospitals the way they are run in Nigeria, especially like tertiary and secondary care, to just, some business as usual, just continue. One of the major problems we have is that the appreciation of what healthcare should be like for the average Nigerian is from the public hospitals. That's the truth. So if I show these kind of videos, I show you the average Nigerian will be like, no, they are just lying. That's not Nigeria. It's not in Nigeria. Do you see that those things? Do you see them in your average public hospital in Nigeria? You don't. Let's not lie to ourselves. So bringing that sort of private initiative where you might have the efficiency, the effectiveness, you're making sure that safety is a key thing in terms of standards, making sure that you're pushing the boundaries of quality and stuff like that. That is the way to go. Diaspora volunteering and support. Honorable Commissioner gave us an idea of statistics of the doctors that we have in the UK. By the way, ladies and gentlemen, please, when we talk about healthcare, we talk about the healthcare workforce. It's not just doctors. I know that the doctor is the poster child or poster boy or girl for healthcare. The other healthcare professionals are extremely important as well. And when you or your family member actually gets sick, especially I'm talking to the doctors now, when your family members get sick, you realize how important the other healthcare providers are. One of my friends was talking to me the other day. She was like, my sister had a hysterectomy. Man, the nursing care was, I was like, you would have gone to be nurse. I'm sure you would think that nurses are just an attachment. How many speech and language therapists do we have in Nigeria? Who knows? Speech and language therapists. How many occupational therapists do we have in Nigeria? So please, the diaspora volunteering and support is extremely important. But guess what? Remember that at the start I said you need government involvement. Who is the best? Who are the best people in our environment or in any environment to be able to coordinate all these things? It's government. That's the truth. That role of coordination, of regulation and stuff, government, they are the best people to actually do that. You will have private people who have very good initiatives and stuff like that, but if government doesn't coordinate them, you now have like all these vertical things happening with very little movement. Okay, but this diaspora volunteering and support is extremely important. You know why? Because you have a pool of fantastic human resource there, and the truth is that we are not even tapping into it. Guess what? Despite all the things I'm doing, and when you watch all the videos and all the things I'm doing, you understand? In the last 3.5 years, I've applied to a hospital to be a consultant in the hospital, in one of our public hospitals, and I've not gotten any word from them. But yet you want diaspora involvement. If I tell this to the average diaspora, what do you think their response is going to be? And the first thing I hear is that, this hospital, you have to come from the presidency and stuff like that. Joke. A big joke, isn't it? A big joke, isn't it? But these are the realities. What I usually say is that it is what it is. It is what it is. Strategic communication. Showing and celebrating success stories. When I came back, I started doing lots of videos, like mini documentaries, putting things out there. Just telling people that the Nigerian patients are worth it. Hey, guys, we can do these things in Nigeria. They are happening in Nigeria already. Just a little bit of passion, a little bit of engagement, a little bit of belief. Even with limited resources and stuff like that, you can still make magic happen. So that should be part of the strategic communication. From government side, hey, put the information out there. Some of the things that Honorable Commissioner was talking about just now, put them out there. Find strategic ways to communicate with the people. Let them know. When I first came out, they were like, the NDC and what was that thing? They said, don't show yourself, don't promote yourself, or whatever. I said, no, I'm not promoting myself. I just want to provide information for Nigerians. I'm passionate about that. Let's provide, because there's this thing, I don't know, it's like if we are purposely doing it, or maybe just by default, we want to hide information. That's one of the things in Nigeria, everyone wants to hide information. No, don't let them know. Task shifting and task sharing. You talked about it just now, task shifting and task sharing. How many doctors do we have in Nigeria? Doctors. How many? In rural creating now as we speak? What do you think? What do you think, sir? How many doctors do we have now in Nigeria? Less than 40,000 for 212 million people. That's what's in the register, isn't it? So it's probably less than that for 212 million people. So where's Margaret, Dr. Kubola? Where are you? I'm sure you put one per 200, and you said one. No, do your calculation well. 200 million divided by 40,000. What's that? Huh? What's that? 50,000 self. So you're having like 1 in 4,000, 1 to 4,000, or 1 to 5,000. Those are the realities. Okay? So if you truly, as a people, as a government, if you truly want to actually provide care to Nigerians that have some basic quality, okay, you need to shift task. And you need to truly try and create things where instead of people going to actually into university to go for microbiology, botany, and zoology, and people wonder, what is this? What did microbiology and botany and zoology do to you? Don't you think we should actually shift those people to nursing, you understand, community health extension work? See, we should think creatively. And then we now need to actually look at advancing the training of some of these people. When you say you want to provide, to do things in terms of international best practices and stuff like that, please domesticate it. That's what they call the global way, isn't it? Think globally, but act locally. You must look at your own environment and what you can do in your environment. Who says that you cannot have community health extension workers that are sharing some of the tasks with doctors and doing some of the things that doctors can do? Who says you cannot have physiotherapists that do some of the things that doctors can do? Why? Why not? If it's really truly going to actually provide care for Nigerians and improve the quality, and if you have only 40,000 doctors, why are you not doing it? Are the Nigerian patients not worth it? Are you going to say, I remember when I said this to somebody who was interviewing me, he was like, oh, the doctors won't be happy with that. I said, so bloody what? If the doctor you're talking about is not going to be happy about it, if the mother in the village has a community health extension worker that is trained well enough that can look at the patient, is he not going to be happy? This task shifting and task we seriously need to look at it. Another innovative thing is the hub and spoke model, especially for tertiary, super tertiary, and quaternary care. An example, we are about 9 neurosurgeons in Abuja. Why are 9 of us not in National Hospital? And then you have maybe like 3 theaters for neurosurgery. And then every blessed day you're doing cases and stuff like that. Number 1, it's going to crash the price of what you're going to spend for neurosurgery. Number 2, it's going to bring business. Number 3, the training is going to be fantastic. Because if you're doing something every day, there was a day I put something up that even a monkey can be a neurosurgeon, and somebody was angry. I'm telling you, if I take a monkey, give him a high-speed drill here, the next day, drill here, the monkey will be a good neurosurgeon. I'm telling you the truth. You hub and spoke model. You move people to a central place, sort them out, you move them back. Even from a business, it will make sense. Even from the fact that you don't have lots of doctors and stuff, it makes sense. Hub and spoke model. Next slide. Of course, that gives you an idea. You have a clinic there scattered around, and you have a hub. So, for example, the National Hospital in Abuja can be a hub for neurosurgical care. You move them in, within 3 years, you move them out. You can even move them to another facility. You've trained them already on how to continue your care. If you have any issues, they just call. You have your residents. Next slide, please. Okay, so this is just a question. What do you guys think? This is an open question. A good number of Nigerian doctors and healthcare professionals like to refer to India and Dubai. Why do you think so? No? Look at it. There's something to it. Okay, so again, sometimes when you're actually trying to make changes or push for changes or push for improving standards, you have to look at your own cultural milieu. If this is something that will make you actually keep patients in Nigeria and build business in Nigeria and create that environment and stuff like that, shouldn't you look at it? Should you just throw it away? Oh no, it's not good. And should you find a way to actually look at it? It's just a question. I'm not saying we must do this, but I'm saying, can we think about it? Is it possible? In terms of, remember, we're trying to reverse medical tourism. Next slide. Every now and again, I'm hearing people, oh man, we've just built a fantastic hospital. We are building this hospital. Oh, it's going to have a 1.5 Tesla. It's going to have this. Oh, we're going to have a 2-bedded, 200-bedded, that bedded. You're hearing them saying, and I'm looking at them. And in my mind, I'm wondering, remember, I've spent going up to 5 years in Nigeria now. And I'm thinking, hey, now wow, where are you going to get the staff that's going to manage these things? Where? I'm telling you the truth, I'm wondering in my mind, where? It takes more than facilities, equipment, and technology to actually provide care that is safe and has some underpinnings of quality. We need human beings at different levels, all the way starting from leadership that is passionate, that is committed, that is courageous. The courage bit is extremely important. Courage. Extremely important. People who are committed. People who are ready to run the course. That's what they call grit. Grit is stamina. When I came back to Nigeria, they were like, he will soon run back. When they show him in Nigeria, he will run back. I'm still here. Where's the camera? I'm still here. It takes more than that. We have some serious situations on our hand. But ladies and gentlemen, giving up is not an option. And can never be an option. And please, to my guys outside Nigeria, in UK, Canada, and the rest of them, when I came back, some people say like, oh, I hope it goes well for you. And I'm telling them, I hope it goes well for me, for your sake as well. Guess what? When their family members have neurosurgical problems, who do you think they call? But they are trying to wish well and hope. And I'm saying for your sake, I hope as well. And so we should continue to push those boundaries. Continue to do everything we are doing. Honorable Commissioner and your state government, good work you are doing, please continue. All the support that you need, I hope your people give it to you. Because we should continue to push, because, ladies and gentlemen, what? The Nigerian patients are worth it. The Nigerian patients are worth it. The Nigerian patients are worth it. Thank you, and God bless you all.
Please, may we rise and give him a standing ovation. In my next life, I want to be like you, sir. Thank you so much, sir. I think you don't have to go first. We have something for you. We can all sit, please. May I, a round of applause again, please. May I invite our Honorable Commissioner to come to the high table, or come to the stage, sorry. Yes, ma'am. Please present an award to this wonderful fellow from C-Hub, a Heroes of Health Award for a champion, reverse medical champion in Nigeria. So you move.
So it's the C-Help Heroes of Health Award presented to Emeka Douglas Okor for his services, his passion, and the fact that the Nigerian patients are worth it.
Yes. Thank you, ma'am. You can still remain on the stage, ma'am. Congratulations.